Yes, we saw the demographics nationally and in Richmond and recognized the growing population of older adults and their needs. And we also recognized the inequities in the community. The lifespan in various neighborhoods was drastically different. And clearly there was a need to engage and find new ways of addressing the needs of the population.
We also learned as we were talking with our nonprofit partners, those in the human services field, were seeing an increased client population from the older adult sector and really struggling with supporting them in the complexities that they brought into these organizations. I think one stark example of that is the homeless population in the community, which has been decreasing significantly over time, except for the older adults demographic. Those in the area of ages 55 and over have been steadily increasing over the last several years. The Bob and Annalise Schaberg Foundation is a private family foundation that has served the Richmond region for many years now. Our mission is to enable vulnerable populations to thrive, and we have several focus areas, including access to safe and affordable housing, stabilization and workforce development, and services that enable children to become successful learners. We fund systems building, we fund collaborations among nonprofit partners, and we also support policy and advocacy efforts.
Yes, and the Richmond Memorial Health Foundation is a health conversion foundation, been around about 3 decades, with a real focus on racial equity and health equity, looking at community needs across the board, mental health, older adults, the intersection between health and housing have been amongst the various things that we've been working on.
The COVID pandemic really helped highlight the vast amount of needs that older adults in our community were experiencing, especially things around social isolation, having access to care, and having their medical needs met while they were isolated at home.
The thing that struck me, I think, was also the needs of caregivers themselves and how they were impacted. Just in terms of things like transportation, resources, their own families' challenges. And so I think a recognition that we've got to spend a lot more time focused on the needs of caregivers.
We were so fortunate to have such skilled and thoughtful leaders and nonprofit providers join us in these convenings. We're incredibly lucky in the Richmond region that we have this wealth of providers. We also learned that there was an opportunity to better connect these organizations to help them work together and collaborate in service delivery.
And I think there was a real hunger amongst the group to have these conversations. They knew each other, but they were so busy that they seldom had a time to sit down together. And so these connections, I think, have paid off in a number of partnerships that have emerged since we began convening.